Airway obstruction and inadequate ventilation are common in unconscious patients. Opening the airway may be all that is required to restore spontaneous respiration. Airway obstruction is often due to loss of muscle tone, with the tongue moving posteriorly, obstructing the airway. Signs of obstructed airway and inadequate ventilation include inability to hear or feel air movement and lack of chest movement. Head tilt and chin lift may open the airway and restore spontaneous ventilation. Anterior displacement of the jaw may also help open the airway. For the patient with possible neck injury, try to open the airway with jaw thrust only, leaving the neck in neutral position as much as possible. If spontaneous ventilation is not returned, suction the airway to remove secretions, blood, and vomitus. Select the appropriate size oral airway. Insert it backwards as it enters the mouth and rotate it forward as it passes the tongue. Use the oral airway in the unconscious patient only, since it may induce vomiting in a patient with intact gag reflex. Now try positive pressure ventilation with bag and mask. Place the mask over the patient's nose and mouth, with your thumb over the patient's nose and your forefinger below the mask's ventilation port. Lift the jaw with your other 3 fingers, squeeze the bag, and observe for chest movement and misting in the mask. If there's a leak around the mask, use 2 hands to hold the mask and have an assistant squeeze the bag. If you're still unable to ventilate, the patient must be intubated.